Folks, thanks for joining us today. My name is John Dubas with Premier Marketing. We'll be spending the next 55 minutes or so discussing the unique relationship, the special marriage between Social Security and Medicare. Many folks can benefit from a little bit of reminders as to how these two governmental institutions interact and how they affect each other at different points in time, particularly in key situations that can affect one and the other. Today's presentation is being recorded and it will be made available on our website at premiersmi.com and on our YouTube channel as it updates. You'll also find that if you've expressed interest in today's webinar, you will be receiving some follow-up that includes a link to the presentation as well. You'll notice in the software system that there is a section for questions and chat. We ask that you put your questions in the questions box. I know that might sound a little bit silly, but you'll find that in many cases through the course of the presentation, we answer many of the questions, but we'll make certain that we address any inquiries that will definitely affect the return on the investment of your time and the value you get out of today's presentation. So let's start with a little bit of a level set as to who Premier Marketing is. For those of you as not as familiar as others, we are a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country, licensed in all 50 states, and we act as an insurance wholesaler working with independent insurance agents such as yourself through contracts at the highest possible commission levels with recruiting contracts available to those who qualify. This portfolio helps us accomplish the need that we have to accommodate the needs of our prospects and clients. And many of these categories are affected by a person's involvement in Social Security and in Medicare. But the programs do cover the base medical coverages for Medicare with the Medicare Advantage and Medicare Supplement plans, along with standalone Part D prescription drug programs. There's also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans, also offering long and short-term care programs and disability income plans, and the ancillary benefits that help cover the particular needs of folks in different niches across the board. And that includes dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, accident and telehealth programs. The Medicare Advantage portfolio has the national carriers there for you for use through our organization and many of the strong regional carriers that can make a difference for you in your market. And the same philosophy carries over into the prescription drug programs, where in most cases, these come as part of the contract for the Medicare Advantage plans. Notable exception, Mutual of Omaha, PDP program only, different than their other products as well. And the Clever RX is actually a discount plan for prescription drugs. The Medicare supplements, large portfolio, programs in place to help you be successful in that space. We want to make certain that we address the needs of the beneficiaries across the income scale, and in the ancillary products in each of the categories, the national leaders are there for you through our organization as well. When we look at the Medicare market overall, as a bit of a level set here, we find that, well, it's a near exponential growth of the baby boomers aging into Medicare. You don't come on a program today like without hearing about the silver tsunami, the aging of the baby boomers, one every 10 seconds, 10,000 plus a day. But in particular interest to today's topic, we're finding that a number of individuals are not accessing their full Medicare benefits when they're first eligible for one reason or another. The pandemic has an effect, Social Security, and the lengthening of the time a person has to be around before they get full benefit of their Social Security retirement programs has a direct bearing on this as well. And so this is an area that will be influenced by some of the topics we'll discuss about today as to how you access Medicare and how you go about making certain that that happens in a timely fashion. It's also a program that is affected by the medically disabled. 15% of the Medicare population is under the age of 65. And this is a population that needs our help in that area because Some of these folks, because of disability, they're able to cycle in to Medicare, but the time period that is involved with it will be discussed today as well. All in all, it's a population that really needs our help because they have 2/3 of them 3+ chronic conditions, some challenges with their income and assets and other concerns, and many of these topics are affected by or mitigated by some of the actions we can help in letting them know where we can make certain their coverages come into play when they need them the most. And that's important because the choices they have enables them to decline certain coverages. The Part B coverage is an optional coverage. Thankfully, most don't decline that, but that will be a topic of discussion. Sometimes folks will then self-insure for what Medicare doesn't cover, the deductibles, co-insurance, and such, and pick up a Part D program, a standalone program to help address drug costs. Some will access Medigap policies and cover the shortfall in the medical coverage and pick up the Part D. Timing is important there as well. And then others will take advantage of the bundling of benefits through Part C and the Medicare Advantage plans. And all of this kind of ties together when we talk about timing and where we do certain things with our folks and how we can use the information on governmental websites to really act as a third-party verifier of the information that we have available and as a source for us to make certain that we have the data, the information necessary to help the people that we are addressing. Choices are changing a little bit here over the last couple of years. We've seen in the past where it was a fairly even split between Medicare Advantage and Medicare Supplement plans, but as the younger portion of this demographic ages into Medicare, we're seeing much more of a atmosphere of comfort with network-based programs and an ability to utilize some of the electronic means of accessing these programs. And so detail on where to direct people when it comes to getting Medicare in play and making the choices on the coverages that they have available to them is very, very important for us. It's also important for us to help translate what the heck is going on for some folks, because there is such a use of acronyms in our niche market that sometimes, well, even we could get confused with all of the different letters that are thrown there. This is a acronym guide provided by the Medicare Learning Network, a governmental site, and this link to this will come as part of the follow-up to today's presentation. We're all aware of the different election periods that come into play when a person is already on Medicare and what they can do to change their coverages and how they can go about taking advantage of some of the special election periods that they have in play. What we want to make certain that we do is determine where we can find this information and how we can help counsel people with the correct timelines put into play here, because there's a whole bunch of folks out there that are already on Medicare and aren't comparing their programs year over year, and it includes a portion of the population that's most vulnerable, and we want to make certain that we are there to help them across the challenges that they have with receiving not only information, but the right information and where to go to find it. Because not reviewing coverages year over year can be very costly, particularly when we look at some of the changes brought about in plans year over year as to the medications that are available on the list that are covered, the formularies, where those drugs fall on that formulary within the tiers. And so being aware of different sites that we can reference, different pieces of information, programs that are out there that are made available by different marketing hierarchies, such as our own, can make a big difference for you as well. Because even if that information's out there, folks aren't accessing it, and we as counselors, we as salespeople, we can help people determine what may well be their best program and make certain that it is handled in a fashion through the appropriate governmental agency to take care of whatever need there may be, because folks aren't doing it on their own, no matter how they could access that information from Medicare themselves. We also want to make certain that we're able to do some things in the manner in which the folks want to receive the information. So is that a live visit? Is it a virtual presentation? Is it a combination of the two? Whatever it is, we want to make certain that folks can access that information in a way that is conducive for them to study and make a proper decision as to their health care and other choices moving forward. We've been training them for 2 years. We, the royal we hate to put ourselves necessarily in the same category as why some of this is happening, but the pandemic has helped folks accept information in different ways. There's one small benefit from this whole fiasco, but it also then gives us a way of utilizing other influences in a person's life to get that information on an electronic basis. Doctor's appointments are done virtually in many cases still, be it a primary care or a specialist. Much of the work in for a planned hospital stay is done digitally ahead of time. Same thing will apply to dentist visits in certain circumstances and other aspects of our life, including how we worship. Well, faith-based organizations are still providing services online as well. And so we have a population that is much more ready to receive information in this fashion, and knowing how to direct people and help them with choices in the interaction between Social Security and Medicare is very, very helpful. So as we speak of this special marriage of Social Security and Medicare, let's look at how we can determine this relationship and start with some of the basics, because a lot of the information we speak of today is found on different websites, different pieces that come into play. So as Mr. Rogers says, we will get you some specific information as per your request. So a lot of folks, they think, okay, I'm about to go on Medicare. Let's just go to Medicare.gov. This is a very helpful site, a great source of information for many people, but it isn't necessarily the site that people will use to initiate activation, enrollment in, however you want to put it, into Medicare itself. Much of that is handled through Social Security and the Social Security website. SSA.gov has a ton of information on it about Medicare itself. And a lot of folks, well, they don't realize that, or they don't look for that, or many of us that have already set up different accounts that speaks to, pardon me, I had a question pop up and distracted me for just a moment. Speaks to how we begin the process of enrolling. Some very simple things. How do you enroll into Medicare Part B? What special effect enrollment periods can come into play? There's an entire presentation just on getting started with Medicare itself that is available for us to use in a seminar or webinar type of situation taken from the government that addresses many of these questions. That is, however, a topic for another webinar that's coming up, because well, we run through the presentation. It gets a bit long if we log everything all together. This site is the alpha site where we begin the enrollment process in Part B, determine some of our eligibility for certain people in Part A, different things that will come into play that is very, very helpful for us. And utilizing this, if we're doing it live with the person next to us, or through a virtual presentation with a Zoom meeting or whatever we use as a means of communicating with people virtually and sharing images, this is the starting place, because it will roll through different pieces of information that apply to different people. So you have, what I mean by that is, we talked about 15% of the population being on Medicare because of disability. Well, this gives us a lot of the information that comes into play there. One of the things that we see for folks that work at the Medicare supplement market, well, in most states, people under the age of 65 have certain restrictions as to the number or the types of Medigap policies that are available to them. And we see that this helps us with some of the information in each of those different categories. So when we look at not only when a person can start, we also have to be aware of how much they have to pay for the different coverages. So a person that has the 10 years of quarters that enables them to receive Medicare Part A without premium, they may be subject to additional fees for their Part B, dependent upon their income uh, that they have in their household as an individual or as a couple. So this is where IRMA comes into play. We're getting a visit from Aunt Irma. IRMA is the income adjustment amount that folks that have higher incomes may be paying a surcharge for their Part B coverage alone. Knowing these numbers and knowing where to find them can make a big difference when you're dealing with the segment of the population that's of higher income. And let's face it, with the average median, whatever you want to say, median income of the Medicare beneficiary being slightly less than $27,000, the majority of people aren't influenced by this. But for those folks that look to address and help the folks of higher income, we need to know these numbers. And we see that as a person's income goes up, be it as a individual or as a couple, so does the premium that they are subject to in order to access Part B coverages. We'll give some history on IRMA in just a bit as well. Some of the forms that come into play with some of these pieces of information, Mr. Tucci, the CMS form, pardon me, L564, showing proof of coverage and the sections on that. Let me get that information to you specifically because I do not have that in this presentation itself. But keep in mind that as you visit with people, there are certain documents that are really important for us to have available to us as part of our presentation guide or reference material. This is one of them. Obviously, some of the information out there that deals with the population that's affected by support programs, entitlement programs, whatever you want to call them, low income subsidy, Medicare savings plans, having that data is very helpful as well. But certain key information sheets like this can make a difference. I don't know of a lot of agents that will memorize the income scale across the board. And for as frequently as many of us encounter this, well, that may not be necessary. It's also important to note that these numbers for 2022 are based on income from 2 years ago. So what we see with many folks that as they retire and come into Medicare, some of them may be moving or divesting of other assets that they may have that skews these numbers. And it can really make a difference then as to what am I going to pay and for how long? There are appeals processes for IRMA. It's also important for us to note that we need the information in hand as to how long some of this will last for people and how we can go about that. But that is another topic all on its own as well. It is fairly simple to help people apply for Medicare. Some folks that are more technically proficient can apply for Medicare online. They can check out their application process as it goes through. They don't necessarily even need to complete the process all in one visit because they can save the application and go back. But it's important for folks to realize that there are tools out there that can really help them through this process, and we're a facilitator of that information. And that includes a checklist to make certain that we're completing all the details that we need in order to help people apply for Medicare online. And you'll notice, once again, it's Medicare as the topic. The website is through the Social Security Administration. This also gives us the opportunity to address folks that may have worked past the age of 65, as we referenced a little earlier in the presentation, and how they go about activating or enrolling in Part B. So you have tools here, once again, to help folks with that information, help them through this system through the website at socialsecurity.com to activate that Part B coverage during the special enrollment period. As we speak to Medicare itself and the Getting Started with Medicare webinar that comes up next week, it gives us details as to that timeline. And that is really important for us to be aware of, that 7-month timeline, 6-month timeline, 8-month timeline for whatever topic comes into play, because we need to make certain that people are making those decisions when they need to make those decisions, so we can keep them from fighting through any penalties they may be levied upon them if they don't do things in the right way. So let's look at here a question that popped up. Bear with me just a moment. The specific forms. This may give us some of that information that was requested earlier, and we'll make certain that you see these. And as part of the follow-up, you have links to the appropriate forms as well. Expectations is a big factor in any relationship. For those of you that have been in a romantic relationship or are married, we realize that communication is a key component in the success of any of those relationships, and that we can really find assistance if we can anticipate what is going to happen after a particular action. What the heck do you mean by that, John? Well, what happens after a person applies for Medicare? You'll be able to make folks aware of the fact that one of the things that they're going to receive once they start this process and get it underway is the government sending them their Welcome to Medicare packet, and that includes their Medicare card as they've completed the enrollment process. That knowledge of here's what's going to happen is a big factor in satisfaction, but it also gives people an assurance that they're doing the right thing in a timely fashion with what is basically an intangible product until they receive their Medicare card. It's the same kind of discussion we have when we visit with folks about the different coverage options they have. No matter what option they select in those choices that we kind of reviewed earlier in the presentation, knowing what comes next can really make a big difference, not only in the satisfaction of the folks that are going through the process, but also helps you control some of the follow-up that comes into play by being preemptive in letting folks know here's what happens next. It can really help with the communication process moving forward, because the folks, one, know that you are a source of this information, but two, also realize they don't have to call you every 10 minutes in a manner of following up on your actions that they've done. You've told them how they can check some different things online, as illustrated in a previous slide, but also the timing that comes into play. So let's utilize all of the information that's available. And once again, this Welcome to Medicare packet, that's described on the Social Security website, not necessarily on Medicare.gov. This is also a site that, for many of us that work with folks that are of lower income and are entitled to different assistance programs, the Extra Help Program, the Low Income Subsidy, LIS program that helps with Medicare Part D drug costs and the costs of the plans themselves. Well, that application process is, yes, indeed, through the Social Security website and not the Medicare website. This is a very interesting way of ingratiating yourself to a segment of the population that really needs your help, but doesn't have a full entitlement mentality, and gives you the opportunity to go in there and help them with this application process totally on a compliant basis, because you're acting on their behalf, and you can walk them through the process of getting help with their plan cost. This is a program you can use year round, and it's not one time of an individual's life. So as you run across people that are in the lower income segment of the population, up to 150% of federal poverty level, this gives you an opportunity to build your pipeline of prospects in a number of different fashions, because, hey, what happens when someone gets that assistance? Yes, it triggers that special election period once a quarter for the first 3 quarters of the year. And that all begins, in many circumstances, with a visit to the Social Security website and not the Medicare website itself. The form is very self-explanatory. There's a link to it right through that site. and it gives you the information that you need to help in this process. I have known many agents that will do this manually, use a form to fill it out, and then complete it online for the individual as an advocate. And that's all compliant as well. It gives us then also the ability to store that information for our files. We obviously need to be very careful about security with this because it has all the personal information in it. So scanning it, holding it online is much better than paper. But even though we may be collecting the information on a basis manual like this, well, we want to do the filing and have the people do the filing for this assistance program online because it's so much quicker, cleaner, much like all the explanation we give you when it comes to all the requests from different entities about doing things electronically. A lot of it goes back to dyslexia in our handwriting. You got the numbers in the right order. Can we read what is written? You go online, well, you might have to deal with flipping some numbers. We need to double check our work, obviously, but you surely can read something typed in a little easier than it if it's handwritten. And if your handwriting is like mine, you think that you are a descendant of Rooster Cogburn or something of that nature, and you just scribble. Well, this helps with that there. One of the things we also really need to be aware of, and for some of us that are approaching this age or the age of being able to access your Social Security benefits, a question that comes into mind and is out there a lot is, when should I file for my Social Security benefits? That too is a separate presentation, but having some of this information, a chart like this, can be very helpful for us in discussing what is going on with an individual, and we see why some folks may be delaying their enrollment in Part B to continue to work, to tie it into their full Social Security benefit period. And we see that the tail end of the boomers, well, you got to be older to get full benefits. That not only affects the individual, but it may affect spousal coverage for one reason or another. And we see how much penalty comes into play if we do file early for Social Security. This is a neat little chart I found on one of the different websites that talks about if you file at age 62, you're getting 70% of your full benefit. The longer you wait, or if you go past full benefit age, well, you get a bit of a bonus as we age into things. Some folks will say Social Security won't be around. We don't know. If it goes like is projected, the latter part of this population may not be affected as much as some of the folks that are still younger than this. So it gives us then detail that we need in our discussions when someone that we're visiting with about their Medicare programs, and we offer life insurance, annuity, other investment programs, whatever it may happen to be, as part of a separate appointment, of course, so we can abide by the constraints of the scope of appointment. But this gives us then the detail that we need to help people time for different things and to put things in play in a fashion that is correct for them. Simple reference material can really aid us in doing just that. There are a number of ways then that if a person is accessing benefits at Medicare at age 65 and has not or is not receiving their Social Security benefits or their retirement benefits from their Railroad Retirement Board as well. Well, in order to keep the Medicare in play, you gotta pay for that Part B. We talked a little bit about the surcharges some folks have, but that's a monthly charge that had a historic jump into 2022, a 15% increase. Some folks point a finger at one singular drug that caused a bunch of that. But folks that go on Medicare at age 65 and are not filing with Social Security, well, they got to pay that Part B bill. And there are 4 different ways that they can pay that as well. So you can do it online. Everything is online now. I had to dig around to try to figure out where my checkbook was for one particular purpose here lately. We do a whole bunch of different things online now. A Medicare beneficiary can do that for their Part B or Part A if it's necessary through their own secure Medicare account. And they can set it up where it's done automatically through a bank draft like we see with so many different programs out there now. A lot of folks have set up all their bills through a draft. There's also, however, the Medicare Easy Pay system, a free system that automatically deducts the premium in a draft type of situation here through working with the government, where they then deduct the premium from the bank account, normally on the 20th of each month. So you can do it through a system through the bank or through the government itself, or you can be one of the folks that say, hey, I'm going to mail a check to the government. I'm going to send them a money order, or I'm going to send them credit card information. You actually have payment coupons that come with a bill. It can be done that way. The payments can be sent in without that coupon. But of these, that's of course the hardest one to track, to make certain that things are done on a timely basis. Because like everything else, Medicare wants their just due for their Part B numbers. And these are some ways to do it and to make certain that we're doing so on a timely basis and not getting behind. That's the joys of having something set up on a draft and doing it in that fashion. Cindy Cooper does make a really good point in the fact that no matter what system you do, in order to set up Easy Pay, you got to make that first payment manually. Thank you, Cindy, for reminding me to make certain that we address that. When we look at then how we can go about speaking to people about Social Security and how the system works, there are carriers out there that have some really cool programs, some really cool presentations that will enable you to visit with someone and speak to them about these needs on a sales track, in a manner of speaking, or a program that helps you, what do I say next? But this is, however, a presentation delivered just from Social Security. And it is a piece that you can use should you choose to do webinars or seminars, live or on Memorex, as the old commercial used to say, and walk through things through a presentation delivered by Social Security itself. This is a presentation, this version of it, that's a couple, well, it's a 2018 presentation. I couldn't find anything more current. So we went through this presentation to make certain that some of the numbers, well, the numbers that come into play are accurate for 2022. And it walks through a discussion of when someone can retire and receive Social Security, or pardon me, the different pieces that come into play by the credits that they earn and the numbers that are involved. So this speaks to the fact that for someone to qualify for retirement benefits, the credits that come into play depends upon how long you've worked and paid into Social Security, and do you have those 40 credits, those 10 years of work at a particular age, in order to maximize the dollars that you can receive through your contributions to Social Security. It gives us then the formula that's necessary to help with determining that amount of benefit, because the benefits are based on earnings. The wages are adjusted for changes in wage levels over time. For many folks, as they retire, oh heck, they've been working 50 years in many circumstances or longer. The first job I had, I was 12 years old, detasseling corn, discovered the joys of taxes. Well, gee, I thought I earned more than that. Well, they're taking out this for this and this for this. So we want to make certain that folks realize what comes into play, and the fact that the monthly average is of the 35 highest earning years. And the results are labeled an average indexed monthly earnings guide. It then tells us in graphic form in this circumstance as to, okay, the longer you wait, what's it going to be when it comes to my monthly benefit? And how can I estimate that? There is on the Social Security website a great tool, that estimator guide, that helps people understand that, okay, here's the credits I have with Social Security, and this is what I can anticipate receiving as my base benefit for the rest of my life. Now, Social Security does have the COLA that comes into play. We saw a large increase for the first time in a number of years on Social Security benefits. much of it gobbled up by that Part B increase as well. But we will see those periodically. That is a COLA that is determined by the government through one means or another. That, well, gee, I got my base benefit. It is creeping up. It's because of the COLA that comes into play, the cost of living increase that affects that amount. It gives us then some graphic detail that we can use in a discussion with folks when they're looking at Social Security, not just as the means, the guide, the vehicle to access their Medicare benefits the way they need to, on the details on that, but also then what's it going to do to affect the monies that they've paid into this system, and what are we going to get out of it. It gives us then also an idea for the folks that, as we referred to in a slide earlier, well, some folks will call it the working aged. So those folks that are 65 and continue to work, how does that affect the amount that comes into play when it comes to the dollars with Social Security? We saw in that earlier slide that little button piece that, okay, at 62, we're getting 70% of our standard retirement, full retirement amount. If we go and work till age 70, and some folks, hey, I like to work, I want to do that, it can add to the numbers that come into play. You'll see here the graphic illustration of what I mentioned before, this a 2018 guide. It gives us then those earning limits at that time period. And that makes, even though that kind of dates this presentation, it makes it evident to the folks that we're talking to that, hey, here's what it is if I tie in at this year, what it would have been, or hey, I've continued to work, that number is different. So it really helps us realize also that there aren't any earning limits after full retirement age. So for me, my full retirement age is 67. I am eligible for the first time this year with my birthday last month to file on Social Security. However, at 62, I'm not at my full retirement age. I'd only gotten 70% of the benefit, and the dollars that I had received, well, could be offset by some of my different earnings. Once you hit that full retirement age, there aren't any earning limits that come into play. This has a direct bearing on certain people that we talk to based on how they earn a living. My father was a farmer, what I call a dirt farmer, a dry land farmer, where you put up a lot of your hopes in please God, let it rain type of situation. So he filed early to make certain that there was income based on whatever circumstances come into play outside of Mother Nature saying, I'm going to rain, you're going to have a crop this year. Different people have different reasons as to why they will file at a particular point in time. And some of it may be prior to that full retirement age because of circumstances that say, hey, it's better for you to start taking it now because of the way you earn income, your health circumstances. Are you able to earn during that time period like you had prior? So some different things that can be very helpful in our discussions there. It is also important to note that how we file taxes comes into play as well, and if we're doing it as an individual or as a household. It comes into play in a bunch of our different discussions. Pardon me for the delay, a little bit of a frog in the throat there, but it is that marriage penalty that people speak of, or different things that will come into play, and that then affects both members of the household. So we want to make certain that in our discussions with people and the relationships they have between these two programs, we take into play, or take into account, I should say, perhaps differences in the ages of the people that we're visiting with in the household. A husband and wife being a few years apart, whatever it is, how that affects the monies that they can receive through their Social Security, and bringing up the question as to how we then handle health coverages for individuals that one is going on Medicare, one's not eligible for it at a point in time. It sends us that reminder of making certain that we're talking to people in a discussion that is built on the foundation of knowing one's going to be able to do this and one can't at this particular point in time. It may also be a circumstance for folks, particularly that are working the under 65 mark, that benefits for a child comes into play. And so folks that are retired or disabled and entitled to the benefits, well, that can affect Social Security for the children as well. I had an uncle who passed away in an untimely fashion a number of years ago with a multitude of young children. And so that affected some of the monies that came into the household based on his untimely fashion, but still taking care of those children that are in the house. Because there are different demographics in play, situations a little different for a lot of people now, where you have an older spouse, generally the male, a younger wife, and they have children at an age that perhaps you wouldn't have seen in the past. That can come into play and can directly affect the outlook for a person's retirement and, of course, the benefits that they're looking to pull through Medicare itself. Spousal benefits. We live in a world now where, well, gee, actually, the last study I saw that divorce rate is way down. Well, part of it is because a whole bunch of folk don't get married like they used to in the past. But in those circumstances, how does that affect a relationship for an individual and their spouse, one way or another? It's not like the old days where the male is always the primary breadwinner. That can vary from household to household. And it's important for us then to note how, if that main earner retires early, how is that going to affect the spousal benefits? And we see that it can have a direct effect on those individuals and can make a difference then in your planning process with other programs that come into play, and may also affect your counseling when it comes to what kind of additional coverage are you going to have to augment the base coverage you get with original Medicare. It also gives us a great way of speaking to folks and having them realize that because of certain income factors that are coming into the household, we really need to do that annual review to make certain that we can maintain the lowest possible cost for some of our coverages, so we have dollars to do what we need to do across the board. Lovingly referred to just a moment ago, divorce rates being down here recently, part for one reason or another, but divorce is much more common than it was a number of years ago. How does that affect the filing as well? And if that is now a situation where you have two households that come into play, does this help you set yourself up for multiple discussions with multiple households to deal with? Here's the information here for folks at 1, 2, 3 easy lane versus the folks from 7, 8, 9 hardship row, whatever it happens to be. It gives us then the opportunity to speak to that person, the affected person's situation, how that affects their monies coming into their household, and how that then affects coverages that they need, and how you can go about making certain that that comes into play. It is a site here then that also speaks to the different parts of Medicare, part of the educational process that's rolled right into this presentation. Note the big disclaimer, go to Medicare.gov for details. Social Security lays out a lot of information about Medicare, the full gambit of information, however, in great detail. That's where we go to that Medicare.gov website for a source of truth in that area, but also to get plan information through the plan finder for folks that prefer that third party providing that information rather than whatever software package you may have available, like our Medicare Center program available to our contracted agents without cost. Basics of Medicare can come into play, and it's amazing too how some people will confuse Medicare and Medicaid because they are close together. Some folks won't realize some of the differences, they will confuse them, but this graphic gives us the information we need when we speak to people about what makes them eligible for Medicare. Obviously, the program's designed for people 65 and above, or folks with certain health circumstances that can enter into the system based on disability. When does that come into play? Well, for most health conditions, it's after 24 months on Social Security disability insurance. And then how does that affect their options for health coverages if they're under 65? Remember, we talked about the Medicare supplements. Choices may be different for an individual in your state by their age of being under age 65 and what options they have. But then, of course, there are the two health conditions that are a means for a person to become immediately eligible for Medicare. Lou Gehrig's disease, ALS. I can't pronounce the full name of that, so I don't try. And then, of course, kidney failure, ESRD, end-stage renal disease, how these two health circumstances can make someone immediately eligible for Medicare as opposed to the 24-month period for other disabilities. It speaks to those timing periods that we talked about, that we need people to be aware of that time period in which they can access their benefits. The program we do next week about getting started with Medicare goes into this in great detail as to that time period where we've got 3 months before, the month of, and 3 months after that 65th birthday to come up with solutions for that individual's circumstances. Hey, do we need a Medicare supplement? Is that most appropriate? Are you comfortable with the premium and the benefits that come with that? No network attached in most circumstances, unless it's a select plan. Or do we go with the Medicare Advantage programs and the timetables that come into play there? Because you've got a couple different considerations there outside of just how do we get into Medicare itself, then how do we get that extra benefits or the means of enrolling into these health programs that give us the opportunity to avoid any type of medical underwriting in that fashion. I have another question that popped up, so bear with me just a moment. As I mentioned before, the program is being recorded, and you will be receiving a link to this, and it will be on our website, premiersmi.com, and on our YouTube channel as well. So this lays out in English. Well, don't mean that. That may not be appropriate for many people that's not their mother tongue, but it gives us that timetable as to what's necessary in that initial enrollment period for enrolling in Medicare itself. And then, as we talked about earlier, what comes next? Well, here's when it starts. Here's when you can access your benefits. So this is a great presentation to walk you through that timing process. And once again, speak to Irma and the fact that the Part B premium for the majority of people is $170.10 in 2022. There is talk that that may be reviewed because of the price cut on the Alzheimer's drug that affected the entire system, one medication. But these are numbers you need to have available when you talk to people. As I mentioned before, because of where the median income is for the Medicare population, you may not run into this as much, depending upon what product niche you may pursue, but you need the information. And it takes us back to Medicare.gov in those circumstances where we can then help people with, gee, I don't know what I did with my Medicare card. Well, we can get one issued for you. How can I check up on things? Well, we set up your own private account so you can monitor your own circumstances through Medicare. These little added services are some of the things that will differentiate ourselves from other people in the same market and give us that one step up on, hey, this person knows what they're talking about. They know where to go for the information. Because as I mentioned before, you don't necessarily have all these numbers memorized, but you know where they are. You know how to access them. You're able then to provide that detail in writing in this circumstance or online, which is the new writing, I guess, and verify the detail that your folks need to make certain they know they're making the right choices and where to go to get that detail. Applying for these benefits, we talked about this to a degree. doing it online, they can do it through the phone number 1-800-772-1213 or through a visit at local offices. Well, local office visits are complicated by the circumstances in our world right now where Social Security offices were shut down for nearly a year. And those are offices that have a number of services that are delivered there as well. Counselors for some of the assistance programs. But you have a lot of folks, they don't want to go someplace to put this in play now where it's like, do I wear a mask? Do I not? How do I do this on a face-to-face basis? You can get some of that same information handled to you. Well, you can get all that information handled by one of the other means of accessing the system, but there are folks that still want the face-to-face, and this can come into play for you. And it's important for us to note that here's how you can get it underway. It also gives us information on a whole bunch of other programs that are available through the Social Security website and how we can find out different detail on them. The site has a bunch of information that folks will find very, very helpful, and this is the way they can access it. Setting up that Social Security account. And I'll confess that if you haven't done that yourself for yourself, you need to. Because as we earn, we want to make certain that the dollars that are going in or that are logged in our account, so to speak, are accurate. And if we wait too long, well, we can't even appeal some of those numbers. It's also where folks can get additional services like a replacement card. Some people say now you don't carry them, but you need them. Benefit verifications on different pieces, making certain that your contact information is correct. You're having direct deposit of your Social Security benefits come into play. Here's how we can direct deposit in 2 different accounts. Even replace a Medicare card there as well, and some of the forms that are necessary for us during the tax season. For folks that don't receive Medicare or Social Security yet, this is also a way they can track that process. And if we establish this is our means of information, we are the folks that help set up the account for our prospects and clients. Well, this is a good way for us then to make certain the numbers are accurate, but also have people self-service to a degree. It's not that we don't want to help people, but some of the base information, well, they may question where it comes from anyway. Coming straight from the horse's mouth can be very helpful. This is like some of the other sites that we deal with carriers, with marketing organizations, with governmental institutions, sites that are evolving. And so we see different pieces that come into play that are enhancements to the system, security for the system. So we don't have to worry about someone poaching our accounts or whatever it is, layering in that security. And we see all sites, but Social Security is site in particular that is evolving to help with that security. Can you imagine a security breach here hacking into the Social Security system? Well, we know it may have happened. Okay, who's that? Behind the knobby, whatever it comes into play here, we want to make certain that folks are comfortable with the security of the systems and having folks realize that it's evolving, much like everything else can come into play. It also gives us then the information we need to help people make certain they know how to log in. I know that might sound very remedial, but these are some of the pieces that differentiate ourselves from our competition, knowing these basics. And if someone calls and says, hey, I know we set up my Social Security account, I can't remember this, I don't remember that. Well, here's some of the things that we can do to get that information sent to you so you can access those numbers, you being the client. Opening the account, if you guys haven't done it for yourself, guys and gals, do so, because it helps you track your income and it's all the details in there. Once again, we can also make certain that we are monitoring our own systems as we move forward. And for folks that haven't done that and they've been on Social Security for a while, this is actually kind of cool for them because they can go in and watch things, look at different details, and make certain that the information on them is current and correct. And it gives you a chance then to discuss these programs as you go through if you utilize this as a presentation. Follow up for today's presentation to send a lot of these as attachments is my asking to be sent to your spam filter in many circumstances. We also want to make certain that you realize that in the follow-up, the links are actual links. They're not a phishing attempt or anything of that nature. And that is probably the best way that we can get you some of these details on these presentations. The overall presentation for today will come to you as a PDF, so please mark us as a safe sender. So this doesn't go into your spam file, or you check your spam folders as well to make certain you receive the information. I mentioned earlier, a multitude of times already, that we have an additional presentation on getting started with Medicare. That presentation comes up next month, but this is a presentation that, in addition to the Social Security information that you can offer people in a singular presentation, you can do a follow-up, as much as what we look to do with y'all on getting started with Medicare. And this is a very robust presentation. Let me show you really quickly. That goes through a lot of the specifics that you'll need for Medicare and that discussion. All compliant. You put in your contact information in appropriate places without boogering it up to take it out of compliance, but it gives you a walkthrough as to a long presentation that, even for me, as much as I like to talk as we approach the top of the hour, gives you the ability to be thorough, but also to cut it up in sections. And you'll see how we do that as well. So that is, tomorrow. So it'll be there and we can walk through this. Some of the things that you'll see as we walk through these different sections as to why we need to discuss these. And Cindy, let me check how many pages there are in that. Well, good gosh almighty, there's a reason why we chop it up. It's 98 slides. So that's a good long one. It's a more of a camp in a lot of situations as we go through things, but you have different sections, and you'll find that as we go through it, I have done a previous recording of it with the different sections to see how long it takes, and I'll get you that detail as part of the follow-up for today as well. Premier does offer off systems that can help you not only with the information you need, the resources you need to properly address questions, but also then a way of having the tools on the back end to address the needs of the people that we discussed and that are uncovered through those conversations. And some of that requires multiple contracts with multiple carriers. This system, Surance Bay, gives us the opportunity to create an agent profile, answer a lot of the questions that are standard in a lot of the contracting processes, and give us the opportunity then to have programs to address the needs, have solutions. So you can do some contracting here electronically. Some of the programs don't participate, some carriers don't, and some of them there may be contracting that is quicker if we do it through an electronic link sent to you directly through our association with those carriers. But this is a great way to store your information and a great way to look at ancillary contracts, particularly in a much simpler and quicker fashion. We do offer discounted errors and admissions coverage for qualified agents. What makes you a qualified agent? Well, you got a contract with us, but this is a program you own, satisfies that requirement with the insurance carriers you work with, no matter whom you're contracting through. So marketing hierarchy doesn't come into play here. It's covering your own financial tuchus in the manner you need to. We also help with discounted continuing education programs through our association with WebCE to make certain that your license stays in play, and you have a way of obtaining disability income coverage for yourself through a modified guarantee issue program that pays you a commission. So a great way to make certain that your own benefit package is full and in play. I talked about the fact that today's presentation is being recorded and will be available to you on our website and on our YouTube channel. Past presentations are there as well. So different ways of marketing to different portions of the population, working through faith-based organizations, dealing with providers, different community work are there, but also detail on programs offered by specific carriers and niche markets as well. Can't speak to the value of this program enough. I had a presentation earlier this week. I think it was just yesterday. My days are blending together, but it is a program for electronic means of dispersing information, oversimplified through a singular login with 3 quoting engines that come into play. But it gives you then the opportunity to procure and store that scope of appointment that's necessary for that 10-year period, if you sell them or not, a CRM in there, a resource center as well. This too is available without cost to our contracted agents. They quote JJ Walker on the commercials we see ad nauseum on TV. It's free. Great tool. Awesome for you to use. And it gives us then different tools within it that help us cross-sell even as well. Many of the programs that are out there will give you additional income or other incentives to do business with a particular company. When we speak of the Medicare world, that doesn't come into play with Medicare Advantage and PDP programs because the max comp is set by the government, but it does for MedSup, does for ancillary programs, does for final expense, all sorts of other life insurance as well, where incentives may be available to you through the carriers, may help you qualify for their trips, may help you qualify for our incentive programs as well. There's a particular page on our website that helps put all that information in one place for you. We do help also get you in front of folks through call lists, through marketing programs for the community, helping with relationships with the carriers themselves to access generated prospects through their initiatives. We have an internet leads program, a direct mail support, a T65 locator, and a really cool way of multiplying one lead into many through the use of referrals. And we want to make certain that we're not putting all our eggs in one basket. So that direct mail program, well, 2 different programs that come into play, deeply discounting the cost of direct mail. You can qualify through health programs and through final expense. So the opportunity to pick up a couple thousand pieces of mail, basically on a 2-for-1 basis almost, dependent upon your production. That is directed through vetted and preferred lead vendors. We want to make certain that their technology's work needs to be to help you. And I got to tell you, with these guys, it is. But it's also a way of making certain that we help keep you in compliance with the pieces that come into play. There are also programs out there that help you with just direct mail response. You're not directing the entire campaign. You're purchasing a particular person who's information on a person who's raised their hand. The cost per program will vary according to what type you select, the area you're in, time of the year. Supply and demand comes into play here, so the cost will and do vary. But it's a great way to plug holes in your calendar or start out with perhaps a little less of an out-of-pocket outlay than a full mail campaign. The internet lead programs are generated through Facebook. There's a system in there for final expense and through the Facebook for Medicare leads as well. One of the things that we find is, well, we live in a microwave society. If you get a lead back through the internet, you better be really quick about getting back with them because they may be responding to more than one outreach and are looking for who can get to me, who can help me now. If you guys have ever done these on yourself, ask for information on one and on a program, and all of a sudden 4 organizations are calling you very quickly, well, they're looking to be the first one in to help you. And if you work a internet lead program, you need to be really responsive on making it work. That T65 locator is more old school with a new school chassis, so to speak. It's something you download on your smartphone, register for, we verify you have contract with us, and it will help then identify on a geographic basis where these people are. So for folks who door knock for final expense or dental coverage or for MedSup, you got to be careful. You can't door knock for MA or PDP programs, but it's a great way to visualize that, put it completely into play. And for folks that are in an area, perhaps between appointments, they go, I want to see if there are folks in this area I can help. A great way to fill in time in your calendar as well. That referral program doesn't apply just to folks that you're visiting with now, new sales. It's a great way to go back and perhaps use the information in the CRM and the Medicare Center that you have there, and work your book of business that way and see what kind of questions we can come in and make that work. So each of these programs that we talk to, there are how-to programs, Jennifer, that will help you with, here's how I get started. I've got a bunch of this already on websites. I hate that sometimes too, where, gee, I've got a plethora of doctors. They all say, well, just check your website. Sometimes that gets a bit tiring. You have to try to figure out, oh man, what's my password on this one, whatever it happens to be. But we have a central repository where you can access the information on all of these programs. Well, that's called our website, and it can help you there. We do all this simply because we want to earn your business. We want to be referable for you, and we're asking for it. Work with us. You'll see a multitude of programs that can come into play. We can get you detailed to be successful in these particular parts of the market that you're addressing. A Social Security webinar, seminar, man, that's an awesome poll. You don't see that beaten up as much as some of the other aspects of our industry. It can help differentiate yourself. And in all honesty, as you go through and prepare for the presentations and deliver them, you're learning as well. So it's a great way to reinforce your knowledge base and work with organizations that want to help you succeed. And because there are programs you can put into play at any time, you don't have to wait to get it going. You don't have to dig around for that round to it coin. You can put it in play and move forward very quickly. All that said and done, I'm going to check again really quickly for questions that I might have missed. And we're walking through these. I'm going to get some specifics for folks on forums and on IRMA information. We've got actually a piece that we are looking to record on just that topic, so you'll have that as well. Once again, thank you, Cindy, for making certain we realize that first payment has to be there as well. Recordings will come. The slide presentations are very large, and you will receive, as part of the follow-up, links to different, how do we do this? Is there a how-to on this? So instructions on it. If you have a particular need, that or question that's come into play generated by our presentation today, you can reach us, of course, at 1-800-365-8208, or you can access contact through our website at premiersmi.com. Watch for the follow-up that will come as part of today's presentation, and you can reply to that, and we'll make certain that we have that detail sent to you so you can move forward. This is the time of thanks. You know, Thanksgiving comes once a year, but every day is an occasion to be thankful for. And I'm thankful that you've come on and invested time with us here today. So for those of you that have done business with us already, I thank you for that business. For those of you looking at us, I thank you for that consideration. But I sincerely thank you for the investment of time that you put in to learn a little bit more, have detail on the topics that we present, and specifically for the marriage between Social Security and Medicare. It's not one that's going to result in a divorce that's going to continue on. We see how one partner supports the other in this relationship, and we'll help get you the detail on how that can work for you. So until we're able to speak again, I'm going to wish you good selling. Thanks so very much, and we'll talk to you soon.